Is your cat straining in the litter box or peeing outside of it? You might have spotted blood in their urine and you're wondering if it's a cat UTI. Hi, I'm Lyndall from Vetster, and today we're covering feline urinary tract infections, what the symptoms really mean, and what to do next. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
A urinary tract infection happens when an infectious organism, usually bacteria, gets into part of your cat's urinary tract. Most often, that means a bladder infection, but here's the surprising part. Urinary symptoms in cats are rarely caused by an infection, and bacterial UTIs are rare in young, otherwise healthy cats. Conditions like feline idiopathic cystitis, kidney or bladder stones and crystals, and urinary tract cancer share the same symptoms, and you can't tell them apart at home. A UTI is also different from cystitis. Cystitis just means the bladder is inflamed. It doesn't tell you why. So, what should you watch for? Blood in your cat's urine. Peeing often in small amounts. Peeing outside the litter box. Straining to pee. Overgrooming or licking the genitals. Leaking urine. And painful peeing or crying out while they pee. Now this is the part to remember. 3 of those signs are emergencies. Unproductive straining, crying out in the litter box, and blood in the urine. Unproductive straining means your cat is trying to pee and producing nothing or only tiny amounts. That can be hard to spot, because straining to pee looks a lot like straining to poop. Some cats with urinary problems pee in unusual spots, like the sink or the bathtub, which makes it easier to see whether urine is coming out and what color it is. If you notice straining or blood in the litter box, contact a vet right away rather than waiting it out. How do vets diagnose it? After a physical exam, your vet will likely run a urinalysis, checking the urine for bacteria, crystals, blood cells, proteins, and other clues. If a UTI looks likely, they'll often recommend a urine culture to identify the bacteria and choose the right antibiotic. Blood tests or a CT scan may also be needed. Dr. Joe Myers, a veterinarian on the Vetster platform, explains it like this. We can't just assume symptoms are due to a UTI, especially since UTIs are uncommon in young and otherwise healthy cats. Furthermore, the most common cause of feline urinary symptoms, idiopathic cystitis, is a diagnosis by exclusion, meaning everything else must be ruled out. Treatment depends on the diagnosis. Bacterial UTIs require antibiotics, and your cat has to finish the full course, even if the symptoms clear up. Stopping early raises the risk of antibiotic resistance and the infection coming back. For other urinary conditions, antibiotics rarely help. Treatment might include pain medication, anti-inflammatories, or anti-anxiety medication, litter box changes, a change in diet, stress management, and in serious cases, hospitalization for fluid therapy or surgery. Never give your cat leftover antibiotics or medication meant for humans. Some human medications are dangerous for cats, and even a safe one might not target the right bacteria. Who's most at risk? UTIs are more common in older cats, also in cats with other health conditions like diabetes, kidney disease, or thyroid disease, and in cats on long-term steroids or other drugs that suppress the immune system. Female cats are at slightly higher risk than males because they have a shorter urethra, and if the UTI keeps coming back, that underlying condition has to be managed properly to stop it happening again. Here's how to support your cat's urinary health at home. Keep stress levels low, since stress is a major factor in feline idiopathic cystitis. Have one more litter box than you have cats, and scoop regularly. Keep your cat well hydrated, with clean water bowls and fountains around the home. A lot of cats prefer fountains, so give them options. Help your cat stay at a healthy weight. Manage any other health conditions your cat has. Urinary symptoms don't automatically mean a UTI, but getting care quickly matters, because an untreated infection can spread to the kidneys and cause life-threatening problems like sepsis or kidney failure. If you see straining, crying in the litter box, or blood in your cat's urine, treat it as an emergency and talk to a vet immediately. If you're worried about your pet, you can book a licensed vet online at Vetster right now day or night. Thanks for watching, and we'll see you in the next video.